for joining us on today's edition of Perspectives, an audience participatory current affairs discussion program on our Gate Radio that beams its searchlight on issues, trending issues, current issues, and then issues of societal importance. My name is Kuanum, Fanen Kuanum this morning, and I'll be with you on the program Perspectives as we look at the topic curbing the menace of drug abuse. Joining us on the program today is Mr. Aboje Ojebe, a clinical psychologist, drug abuse prevention and treatment practitioner, and an author. He's a staff of the Department of Psychiatry, Benue State University Teaching Hospital, Makurdi. Mr. Ojebe, it's a pleasure to have you join us on the program today.
Thank you very much. Thank you for having me.
All right. Remember, this is an audience participatory program, like I said. So in due course, the telephone number dedicated, the studio line would be open for you to be a part of the program. In the meantime, the number dedicated for WhatsApp and text messages is already activated for you to start sending in your input. That is 0912 699 9404, 0912 699 9404 for SMS and WhatsApp messages only. All right. So now we go straight into the program. Drug abuse is not anything new to most of us. And, we've talked about it on several occasions. But for the sake of perspectives, bringing it to perspectives, we want to, start with the meaning of drug abuse. So, Mr. Ojebe, you have been in the front line, counseling and then aiding the treatment of people who have abused drugs. So I want you to tell us, what is drug abuse?
Thank you very much. There are many definitions of drug abuse, but in the field of drug abuse prevention and treatment, there's a particular definition that encompasses what we are looking at, and I would like us to see it as the use of psychoactive substances. And psychoactive substance refers to any substance that, when administered into the body, has the ability to alter the activities of the central nervous system, looking at the brain and neural impulses. So, in a nutshell, drug abuse is the use of psychoactive substances, mind-altering substances, substances that alter the mood, the perception, the emotions, and the behavior of anyone that has administered this substance into his or her body. And we have substances like psychoactive substances like social drugs like cigarettes, talking about tobacco and alcohol. We also have illicit drugs that are psychoactive substances that are illicit, that is prohibited. Its sales, possession, and use is prohibited by the law. Illicit substances like crack cocaine, marijuana, substances like heroin. And I also have non-medical use of prescription medications with psychoactive properties like pentazocine and morphine, and substances like tramadol, codeine. There are prescription medications, but its non-medical use is also termed as drug abuse.
All right, so we want to look at the current, state of drug abuse, the prevalent rate. You have been interacting with people who have this condition or who are involved in this act. So what would you say is the prevalent rate of drug abuse in Benue State, where you practice?
All right. We are going to begin from the global prevalence, and then we'll narrow it to Nigeria, and then I'll be able to say a few things about its prevalence in Benue.
Okay.
In the United Nations Office and the United States, the 2018 Global Drug Survey reveals that over 2 176 million people between the ages of 13 and 64 has abused psychoactive substances other than alcohol and tobacco. And within that number, 31 million of that number have developed what is called substance use disorder. And now, when you narrow it to Nigeria, it is also revealed that I'm still making reference to the 2018 survey. In Nigeria, about 1 out of 7 persons has abused psychoactive substances. 1 out of 7 Nigerians between the ages of 15 and 64 has abused a psychoactive substance other than alcohol and cigarette. And it's also revealed that 1 out of 4 of such persons is a woman. And it's also revealed that 1 out of 5 of that number has developed substance use disorder, what is known as addiction or substance use dependence. And it is also revealed, in that same survey, it is also revealed that 10.6 million users of psychoactive substance have abused marijuana. That is to say, marijuana, or what we call cannabis, is the most abused psychoactive substance today. That in Nigeria, we have over 10.6 million persons that have abused marijuana.
Is it because it's rampant, it's easy to access, or what exactly makes it the most abused drug?
Of course, accessibility is one of it.
Okay.
All right. One of the factors of drug abuse, which we are going to be looking at, is availability of drugs. Yeah, cannabis is more or less available.
Okay.
And its use, that survey also revealed that the initiation of use of cannabis is as early, young people start initiating the use of cannabis as early as 19 years. Yes. That prevalence, that statistics is quite worrisome. And if you find out in Benue State here, the prevalence of psychoactive use is very, very high. It will interest you to know that in my clinic at the Department of Psychiatry, Benue State University Teaching Hospital, 70% of the patients that we provide care for, we provide mental health care as well as addiction care. 70% of the patients we have on admission are persons whose mental health case is related to substance abuse. So the statistics is worrisome. If you go to Federal Medical Center, the Department of Psychiatry, and other privately run rehabilitation centers, you will find out that the number of young people receiving mental health challenge, a good percentage of them is as a result of the abuse of psychoactive substance.
Okay, so you've started mentioning that, but I'd like you to project it more, the impact of this high prevalent rate of drug abuse on individuals, on families, and of course the entire society. What impact does it have? Does it leave on us?
Okay. Before you talk about the consequences or the impact of substance abuse, it will interest you to know that there are myths and facts about drug abuse.
Okay.
Yeah.
That's interesting.
Yeah, there are myths and facts about drug abuse. Some persons will tell you because a particular substance is not prohibited by law, then it is safe. For example, we have what we call social drugs. Yeah, like alcohol and cigarettes. The sales, possession, and the use of these substances is not prohibited by law. There is no law in Makurdi, there is no law in Benue or in Nigeria that prohibits the sale or possession or the consumption of alcohol and cigarettes. So a lot of users think since there is no law prohibiting its use, then it is safe. But the truth is that these substances are psychoactive substances. They have tendencies to alter the functioning of the central nervous system and leave, most times, permanent damage to the brain. So I usually say that something is permitted by law does not mean it is harmless. That is one myth that a lot of drug users or that the society holds. And secondly, that's looking at psychoactive substances like painkillers, prescription painkillers like pentazocine and morphine and all of that, and tramadol and codeine. These are prescription medications with psychoactive properties. That they are prescribed does not mean its consumption, for non-medical use is also safe. All right, it is still dangerous when consumed, when consumed for non-medical reasons or without the prescription of a physician. Yes. So before talking about the consequences of psychoactive substance, I would like us to establish this fact as against the myth that we have come to accept over time. All right. There are so many consequences of psychoactive substances, ranging from physical consequences, psychological consequences, social consequences, as far as its consequences in the family and then in the school, talking about the school as well as the students involved. All right, let's quickly look at the social consequences of drug abuse. When you talk about its social consequences, you're looking at consequences in the society, the menace of drug abuse in society and to the individuals involved as well as the family. I would like to begin from talking about, things like cultism.
Okay.
Yes, things like cultism. One of the social consequences of drug abuse is cultism. When I mention cultism, I would like to also say that cultism and drug abuse is mutually exclusive.
Okay.
Yes.
So why do you say so?
Yes, because you look at cultism when a young person begins to use psychoactive substances, becomes a psychoactive substance user or a drug abuser, the chances of that person becoming a cultist is high. All right? And you hardly find a cultist who is not a drug abuser.
Okay.
So they are mutually exclusive. So drug abuse increases an individual's risk of becoming a cultist. Then secondly, we have political thuggery as one of the social consequences. We have hired killing and assassination. We have theft and crime. And we also have terrorist activities. Individuals that get themselves involved in these antisocial behaviors or antisocial pattern of life, you hardly find them doing it without being under the influence of drugs. All right? So the use of drug, any society where drug use is prevalent, you also expect these social ills, because persons who get involved in this are usually under the influence of psychoactive substance in doing this. So the prevalence of drug use in a society exposes people to these kind of social ills. All right. We also have the psychological consequences of drug abuse, such as emotional instability, mood swings, anxiety, and depression. I'm into drug abuse prevention and treatment. In the hospital or in the psychiatric ward where we provide therapy for persons that have developed drug use issues, we see these psychological, symptoms in them, such as emotional instability, mood swings, anxiety, depression, aggression and violence, hallucination. I will explain hallucination. Hallucination is a perceptual distortion. Okay, when the perceptual pathway is distorted, an individual begins to see pictures, to see things that are not existing, to see things that they are the only ones seeing them. They start hearing voices, start feeling things moving on their skin, or it's called hallucination. All right, and certain psychoactive substances, we call them hallucinogens. Okay, prolonged use of these substances can cause individuals to begin to experience these psychological consequences. We also have memory loss, psychosis. We also have confusion, impaired judgment, euphoria, decline in dressing and appearance. These are all the psychological consequences of of psychoactive substance use. And of course, we have physical consequences, which we refer to as the impact of drug abuse to physical health, like damage to the liver, damage to the kidney, damage to the brain, damage to the liver and the lungs. The physical consequences of substance abuse refers to basically, physical health challenges that accompanies drug use.
Okay, two issues you mentioned before we proceed. One of which was when you said drug abuse and violence, are correlated in a way. All right. So, and I was just thinking, why is it so? Because a lot of people think that when I take drug, I can be able to speak my mind. I can be able to be bold enough. And then, is there any kind of maybe low self-esteem issues there? That's one. Then number two, you did talk about hallucination. And I've also witnessed a case of a close family member who I can say is not into some form of drug abuse, but somehow got down with the issue of hallucination, seeing physical things that you cannot see, listening to voices that you cannot listen. So a whole lot of that. So one would, of course, argue that it's not the drug abuse. Or once they start putting forth such behavior, should we then, think that they are into some drug abuse, substance abuse also?
I would like to speak from the first concern you raised. When we talk about drug abuse and violence, they are, like I said earlier, they are related. Okay? When an individual is a user of, like I said earlier, they are psychoactive in nature. They alter the functioning of the brain. They alter how an individual thinks, and they alter the emotion as well as the behavior of such an individual. And this can predispose them to violent acts. Are you with me? So when you look at the society, for instance, and people that are involved in violence acts such as armed robbery, cultism, terrorism, political thuggery, it is found and established by research that such persons are usually under the influence of drug as at the point of performing such acts. And then secondly, you made mention of hallucination. Hallucination is a symptom, is a psychological symptom, which means something has gone wrong with the brain. Okay? It is not only drug abuse that makes an individual to hallucinate. It is one of the factors. Hallucination is also a symptom of mental illness. For example, in mental illnesses like schizophrenia, hallucination is one of the symptoms of schizophrenia. All right? It simply means something is not all right with the brain, either as a result of a mental illness or the introduction of a psychoactive substance to the brain. So when you see, it's possible for an individual to develop a mental illness without the involvement of substance and still experience hallucination as one of the symptoms. All right? So when you see an individual hallucinating or saying he or she is seeing pictures, seeing things, or hearing voices asking him or her to perform a particular action or to speak in a certain way, that doesn't mean it will be wrong to conclude that must have been happening as a result of the use of substance. All right? Hallucination is also a symptom, one of the symptoms of mental illness.
Okay, that's clear enough. Okay, now, so how can we differentiate between drug use and drug abuse?
Yeah, professionally, it is used interchangeably.
Okay.
Yes, we use it interchangeably. When we are referring to the use of psychoactive substance, we call it substance use, drug use, or drug abuse. Okay. All right. Professionally, it is used interchangeably. But to the layman may not, see it as such. Most times when we go for outreach programs and we get people to speak and we say, can you define what drug abuse is or drug use? You find people telling you, you hear things like drug abuse is the use of medication without the prescription of a physician. Are you with me? So you see, there are these definitions. Some will even tell you, of course, that is abuse in its sense. Self-medicating is abuse. All right? Using a particular medication for medical use, okay, other than the way it is prescribed, is termed as abuse. But in the context of psychoactive substance use, abuse, we can say substance use, substance abuse, substance or drug abuse, we use it interchangeably when it comes to psychoactive substance use.
Okay.
All right.
So the next issue is we want to look at the causes and then the risk factors of drug abuse. So first of all, I'd like you to tell us some of the underlying causes of drug abuse, and then of course how we can address them.
Okay, thank you very much. The reasons why people use drug is it's not a single reason. The reasons are multiple. There are many reasons why people use drugs.
Okay, we'll dwell with some of them then.
And when you're talking about the reason why people something is happening, if we are able to understand it and point our fingers to it clearly, that gives us an advantage in solving it. All right, when you understand the cause of a behavior, that gives you a vantage position to be able to profile solution. So we are going to be looking at some of the reasons. One of the reasons why people actually initiate and continue the use of substance use is hereditary.
Wow.
The use of substance is people can be at risk of using substance by being born with the gene. All right? There is a family history for drug use. An individual can have a family history for drug use, and that puts the individual at risk of developing, drug use problem to about between 30% to 70%. All right. So addiction to substance is linked to the genes that an individual is born with. So one of the reasons why people develop drug use is genetics. All right. An individual can, for example, a father who has an alcohol use problem, okay, what people call alcoholism, is simply an alcohol use problem. Such a man, when he gives birth to children, the children are at risk of developing problems with alcohol use to about 30 to 70%. So that such a person has such family background does not mean it will occur. Other factors, other environmental factors can interact with that already existing biological predisposition to now resort to the problem. Okay, so hereditary is one of it. Genetics is one of it. Okay. It can, the gene for substance use issues can be inherited. And secondly, which is the most important, which is the most prevalent and significant today, is peer pressure. All right? When we meet people, when we're doing assessment for persons with drug use problem, and we take them into assessment and begin to ask, majority of them tell us they started using substance because their friends were using. Peer pressure. I started using because my friends, were using. And I was told that for me to belong to a particular class, to belong, I have to start using. All right? Using because your friends are using is one of the major problems. Peer pressure. They need to belong. They need to belong. They need for acceptance. There are certain, how will I call it, clique of friends that an individual may have, and they are telling you, for you to belong to our class, you have to start using. All right? At certain age, you have to initiate the use of alcohol and cigarette and marijuana to belong. So that pressure from peers, from friends, peer influence from friends have accounted to reasons why a lot of people initiated and have continued the use of alcohol and other drugs today. Very, very significant. It's not only common among children and teenagers, but also adults. There are adults today who initiated substance use and continuous use as a result of what? Peer influence. Let me quickly run through other reasons. We have availability of drugs. Is one of the reasons. This is simple economics, the law of demand and supply. All right. So if we have supply, if there is supply of a commodity, definitely the demand for it will begin to rise. Drug abuse may be initiated at an age. Availability creates awareness, which leads to curiosity. Availability will create awareness. When a commodity is available, it creates an awareness. It announces itself. I'm available. And its availability will in turn create curiosity. And people will begin to be tempted to experiment or to use occasionally or to become regular users. So it is the availability aspect that we have the organizations like government agencies like the National Drug Law Enforcement Agency to track availability. All right. Those of us that are into prevention and treatment, we deal with drug demand reduction. All right. We engage with society, we engage with people to see how we can reduce the demand for substance. While on the part of the government, through its agency, the NDLEA, is to track supply. That is why they go after drug traffickers. They'll go after drug traffickers, arrest them, confiscate their supplies, take them to custody, charge them to court, and prosecute them. Okay? So drug supply, availability of drug is one of the major reasons why people abuse drug. We also have advertisement. No thanks to the media when it comes to the drug use. Advertisement is an influencing factor of drug abuse. It is closely related to drug availability. Because you see, the way these media houses advertise drugs, especially alcohol.
I'm sure we don't do that here.
Yes, the way, yeah.
Let me speak for us.
When you talk about media houses, television adverts, prints, print media. We have billboards today advertising alcohol.
The outdoor media.
Yeah, outdoor media, advertising alcohol, advertising cigarettes around the city. What are you communicating to the young minds? All right. The real customers of these brands are the ones that are drinking and falling into the gutters. Those are their real customers, but they hardly put them on the billboard. You see, they hardly put them on the billboard. You hardly see a drug user in chains on the billboard being advertised. All right. So you now see that how the young mind function is that.
All right, if you're just joining in, you are listening to Perspectives on Agate Radio 95.5 Star FM Makurdi. And then we're looking at curbing the menace of drug abuse. With us in the studio is Mr. Aboje Ojebe, a clinical psychologist and drug abuse prevention and treatment practitioner and author, the staff of the Department of Psychiatry at the Benue State University Teaching Hospital, Makurdi. Okay, Mr. Ojebe, you were talking about advertisement of drugs, billboards, how drug manufacturers do not, advertise with their own customers, original customers.
Yeah, what I mean is that the persons that are suffering from the consequences of what they are advertising, they hardly project them. All right. So the glamour that comes with advertisement of these drugs makes them attractive to audience. For example, a young mind who is looking up to one of these movie veterans, let's say in Nollywood, as a model, and then you see an advert of Gouda with this same movie veteran and a bottle of Gouda, a very big bottle of Gouda, on that billboard. What are you communicating to the young mind? That this person you are looking up to as a model probably got to where he or she is by using this substance. So association has occurred. All right? Maybe you're looking at a movie star, let's say Yul Edochie, and he's on the advert of Hero. You know, what are you communicating to that teenager? What are you communicating to that young child that watches this, this movie star and looks up to him and is on a billboard, an advert billboard with a bottle of Hero? You are trying to communicate that he drinks Hero. He got to where he is today as a movie star that you look up to so that association has occurred. And the next time you begin to, for me to become like this person that I look up to, I have to, the glamour of that advertisement, makes substance, especially alcohol and cigarette, very, very attractive. Of course, illicit substances like marijuana, crack cocaine, methamphetamine will not be advertised. But gateway drugs, social drugs like alcohol and cigarette, of course, I mentioned gateway drugs. Social drugs like alcohol and cigarette are not prohibited. Its sales, possession, and use is not prohibited by law, but they are called gateway drugs. When an individual begins with this gateway drug, alcohol and cigarette, it opens the door, as the name implies, gateway door. It becomes a gate to other, more lethal psychoactive substances like marijuana, crack cocaine, methamphetamines, ketamine, HCl, ecstasies, inhalants, and the rest of all. All right. Another reason why people use drug is the culture they come from. Of course, culture is defined as the way of life of people. There are certain cultures that see the use of alcohol, see the use of cola nut, see the use of cigarette as the norm. When a young man is growing, you are not seen as a man yet. You're not seen as somebody that has grown yet until you initiate the use of alcoholic beverages like alcohol and palm wine. Of course, palm wine becomes alcoholic when fermentation takes place. Palm wine contains, ethanol naturally as a result of fermentation. So when people in this culture see growth and maturity as when an individual starts initiating the use of substances, in certain cultures, when they see you with a bottle of beer, they see you with palm wine, they say, of course, this my son has
He's a man indeed.
Yeah, it has become a man. So such way of life of people predisposes young people to the use of substance. And one very important factor again is drug abuse in the family. The family is one of the most important, agent of socialization. Of course, socialization refers to, that institution or that practice that converts a biological animal into a social animal. During socialization, people learn. During socialization, norms are established. And the family is one of the important agents of socialization where young people learn a lot of things as they grow up. In those values in the family front. For example, when I mention drug abuse in the family, when father is a drug user or an older sibling, children in that family automatically becomes at risk to using substance. I've seen parents, fathers especially, who send their young children to go and buy cigarettes for them. Of course, children won't learn what you are telling them to do. Training, especially training a young child, is observation. You teach and you show. All right, you may be telling your young child not to initiate the use of substance, but you are showing it. Your words and your action, they are contradictory. It is what you show that your young child will learn. So we have a lot of fathers that are modeling drug use to their children today. So the family background has become a risk factor to substance use in a lot of young people today. We also have families where you see a father will sit down drinking beer in the house and he gives a sip to that young child. And then that child takes a couple of sips and then he or she begins to, get intoxicated. It's a source of fun to them, but you are putting that child at risk. You are endangering that child. You are exposing the young brain of that child to a substance, to a psychoactive substance. No matter whether it is alcohol or palm wine or whatever, it contains alcohol and it is psychoactive. So that, it poses as a risk factor to future initiation of substance use. We also have factors like parenting practices. Parenting practices refer to the way, the way that parent chooses to rear their children. Okay, the practice parents adopt in rearing their children puts the children at risk of drug use. We have parents that are overly strict. We have parents that are authoritarian in their parenting style. They are overly strict. We have parents that are also very, very permissive. We call them permissive parents. The overly strict parent is, such families that are governed by strict parents. They are like children grow under regimented environment where there are little or no regard for their emotions. There are rules and regulations. We also have this, type of parents where children are left to themselves. Permissive parents. They are left to themselves. They are left to do whatever they want to do. I conducted the research in my early days in the university on the influence of parenting style and peer pressure on substance use among secondary school students in Makurdi metropolis many years ago. And these were my findings. Looking at the parenting style, all right, I consider the three parenting style: the authoritarian parenting style, which is the overly strict parenting. I also considered the permissive parenting, where children are left to themselves with little or no guidance. In the middle, that is a parenting style called the authoritative parenting, that draws on the strength of the authoritarian and draws on the strength of the permissive. All right, it's like a democratic parenting style. All right. So, and these were my findings.
Okay.
I went to secondary schools. Data. I didn't manufacture data. Went to secondary schools, collected data from secondary school, using the appropriate questionnaires to access these variables. And these were my findings. Children that grew up in families where parents were practicing the authoritarian parenting style, okay, proved significant to substance use from the result. And then also children that are raised by permissive parents are at risk of initiating substance use. But it wasn't so for children that were raised in that authoritative environment. Remember, there's a difference between authoritative parenting and authoritarian parenting. The authoritative is the democratic parenting. Why in such parenting environment, in such parenting practice, there is discipline as well as love. All right? There is discipline. You discipline your children when you need to, but the children can also come to you, and express their concerns. All right? Such parenting styles is known as the authoritative parenting. That authoritative parenting, from that research, revealed that it is a protective factor against the initiation of psychoactive substance use. Okay. Then, of course, peer pressure proved very, very significant in determining the initiation of drug abuse.
Okay, that question usually had two sides. Okay. So, and you did say there are a whole lot of, causes, and you've mentioned you are ready to go on and on and on. But for the sake of time, let's step aside a bit to look at how we can address them, because you mentioned hereditary, you mentioned peer pressure, you mentioned media advertisement, you mentioned culture, and a whole lot of them. All right, so particularly, should one who is, into drug abuse hereditarily, shouldn't that a person just say, well, that is, I was born like that, or is there anything that can be done with them?
Okay, all right. An individual that has a family background, of drug use, like I said earlier, he or she has inherited a gene that has made the individual biologically predisposed. It is not only drug use that an individual can be predisposed to biologically. There are health situations, especially mental health cases, other mental health cases, that an individual can be. There are also physical health conditions like diabetes, like hypertension. These health conditions can be inherited. But an individual that has such family history doesn't mean that it will just start happening. Environmental factors will have to build on this biological predisposition to precipitate the condition for the individual to start experiencing episodes of this condition. Same thing applies to substance use. An individual that has a family history of substance use, and then in the future, by listening to this program, you come from a family where your father, is or was has issues with substance use, and haven't listened to a program like this and heard the consequences of drug abuse, that puts you, that gives you the responsibility of prevention. All right? That means you should be more careful. You should be more careful when it comes to psychoactive substance. It puts responsibility on you. It should serve as an eye opener to know that you are not like any other guy. All right? Two individuals, two young men can go on the same day and experiment on marijuana. One will develop a mental health issue. The other will smoke marijuana for many years and still be going around his or her normal activity. Available in the order. All right? So, having known your background, are we together?
Yeah.
Having known where you are coming from, you should be very, very, very careful. Perhaps you are listening to me out there. This message is for you. Having known where you are coming from, having known your family background, you have to be very, very, very careful. And then some of the prevention principles we are going to be sharing, take it very, very, very seriously and ensure that you apply them.
Okay, so how about peer pressure? Are there some tips you would like to give some young people to be able to, get saved from the pressure of peers into drug abuse?
All right. Before I answer that, when I was mentioning the causes of drug abuse, I was providing insights into them, and that took a lot of time. But permit me to just mention and all that. So, looking at things like peer pressure, when I speak to young people, whenever I embark on prevention campaigns, I tell them, you are not like any other person. All right? To be able to withstand peer pressure, there is no age an individual escapes peer pressure. Even at 70, you have peers now. There are certain things your peers will influence you to do. Even at 80, all right? There are certain decisions people make across different stages of development that is influenced by their peers. But now we are both good and bad, all right? So in order to avoid peer pressure, there are a lot of social skills we teach young people. One of it is the refusal skill. We teach parents and also teach teachers to drive it down into their young children. Okay, peer pressure is not peer pressure. The influence of peers on an individual, and it goes beyond. It's for every problem behavior, like initiation of sex. All right, stealing, getting initiated into court. Peer pressure has a role, not just substance use, but today we are talking about substance use. That is why we are limiting it. One of the things we inculcate into young people, and we also teach parents and teachers and then handlers of young people to drive down and inculcate into them, is refusal skill. Refusal skill is one of the social skills that every human being must develop to be able to stand against, peer pressure. The ability to say no to peer influence is very, very, very important. Very, very important. People that lure our young people into substance use, they come by telling them, you want to belong? Come, let's, without taking this thing, you cannot belong. You take it, it makes you feel good and all of that. You see, especially young people that are shy. Are you with me, sir?
Yeah.
Young people that are shy, that have, have this problem with standing before the opposite sex to speak, or standing in the midst of crowd to perform an art or to speak publicly. People have this problem inherent in them. All right, is an anxiety issue. We call it social phobia. A lot of people are still I experienced this problem, but for the fact that I've able to, develop or come up with some avoid, strategies that help them to avoid social situations like that. But you see, people that are faced with these issues look towards the use of substances like alcohol, because when you under the influence of substances like alcohol, it has an inhibiting factor. It has an inhibiting influence. Sorry, all right. It distorts the judgment of individuals. You see, an individual that is normally shy, all of a sudden becomes bold. All right. Substance can do that, but we teach them not to look the way of substance. It can help you overcome shyness today, but in the long run, you may develop a problem, dependence or addiction as a result of that. So we tell them to, seek professional help. Okay, there are simple, brief psychotherapeutic, strategies, techniques that can help one overcome shyness and become bold. But for the issue of peer pressure, we advocate that young people be taught social skills like relationship skills, how to say no and still be okay. A lot of people cannot refuse peer influence across from children, adolescents, adults, and even the aged. Once your friends are telling you something, you just pick on it and begin to implement. All right. So the training on life skill, life building skills, social skill to be able to withstand peer influence is a preventive measure. It's one of the many preventive measures for substance abuse.
Okay, so moving on, there was an argument we engaged in, a funny one though, looking at people who are lunatics, that's mad people, looking at mechanics, and then people that there's a semblance among them. So my question now is, how do we identify individuals who are at risk of drug abuse?
Okay. All right. It's not far-fetched.
Okay.
Okay, because if you look at there is this classification of individuals, especially for those of us that are prevention practitioners. When we go to implement these strategies, we look at the universal population. All right, the universal population is made up of both people that are resolute non-users, people that are at risk, and then people that have started using. All right, so we have this population called the selective population. Okay, it's usually made up of people that are at risk. They have not started using, but they are at risk. And then we also look at indicative population, people that have started using, either at the stage of experimenting, or they are occasional users, or they are regular users, or people that have developed dependence, or what we call addiction. But you are not asking about how to know people that are at risk. All right, let's begin with this. Persons that are from families with history of substance use, they are at risk.
Okay.
All right. Young people that have been exposed to poverty and violence, they are at risk. All right.
Poverty, you said at risk.
Yes, poverty.
What we now call broke.
Yes,
that means a lot of
people that have background, people that are from background.
Okay.
People that have known poverty all their lives, they are at risk of substance use. Persons that have been exposed to violence, to adversity, like we have, children and young people in communities that were ravaged by violence, ravaged by terrorism, herdsmen attack, and they are, they have been moved from their communities to the IDP camps where they have lived for many years as refugees. Such people are at risk. Such people are at risk. Children that are being reared by overly strict parents, they are at risk of substance use, because a time will come, such a child will inevitably leave the grip of that parent, and they'll say, freedom at last. I'll bring through the words of the university where we have children that were young people that were raised by such parents, overly strict parents, and by the time they got admission into university, they say, oh, freedom at last. Such persons always find it difficult to manage the freedom that comes with operating, being on campus. And then you see them experimenting, all manner, experimenting with boys and the opposite sex, experimenting with substance, experimenting with gambling, and even cultism. And also parents, children that are raised, that have come from homes of parents that are permissive, children that are left to themselves, they are also at risk of developing problem behaviors like substance abuse. Let's look at another, factor to substance use, which is the nature of job. Things like mental health, the unemployed. People within this category are at risk of substance abuse. The unemployed, for instance, they're usually frustrated. Idle. They are not occupied with, there is nothing occupying them. We have them in Makurdi. As early as 7 o'clock, 8 a.m. in the morning, you see these alcohol kiosk, where they go to, drink, take shots in sachets, and then they smoke. As early as find out the young men that patronize these alcohol and smoking spots, find out a good number of them are unemployed. So people that are unemployed, they are not employed, they are not gainfully employed, they are not doing anything, they are just, at home in the mornings, waiting for the wind of any activity to come and blow them. Such people are at risk of substance use. People that are factory workers, talking about the nature of job as a factor, factory workers that work all night, that do, that do heavy, manual labor, they are at risk. Go to Wadata area, from towards the new garage area. Our young men that are into that go to the that go offshore into the river Benue to scoop sand and gravel. The nature of their job. A good number of them are into abuse of substances like marijuana and tramadol. Look at our truck drivers at night. Our truck drivers. The nature of job, they take substances to be able to keep them awake. They're at risk of drug use. And of course, people with mental health issues. Mental health and substance use, they're also mutually exclusive. People with mental health issues, they're at risk of substance use. And also persons that are using substance, they're also at risk of developing mental health issues.
Okay, so what's the other category you talked about? Because you talked about people at risk and then people who have started experimenting already.
People that have started using, we call them the indicative population.
Why I'm asking you this question is that it's very difficult most of the times to lure these people into seeking help. All right, some of them may be abusing substances, but we never agree with you that they are into that, and they will never agree with you that they need help. So how do we identify such?
Yeah. You're talking about people that are using already, right? But it's difficult getting them to accept that that is need for them to get help.
Maybe they are still hiding.
Yeah.
Maybe some of them, they are experimental stage, like you said. And then how do we identify them?
Okay. Looking at the stages of drug use, it begins from experimenting. Okay? For whatever reason, an individual decides to initiate the use of drug, there is this stage called experiment. It begins with let me experiment this thing, either from curiosity, out of peer pressure, or for whatever reason. It begins with experiment. What is an experiment? Let me see how this thing feels like. There are persons that at that experiment stage, they went into being non-users, and they never used again because the outcome wasn't pleasant. There are, in high quantity, and they have been sustained users. But one thing is very, very, very common among people that are using drugs. It's called denial.
Okay.
Yeah. A lot of people deny that they're using drugs. Even when it has become a problem to them, they still deny that it is a problem. There is a lot of denial among people that are using drugs. Even when it's obvious that they are suffering occupationally, their academics is suffering, their physical health is compromised. even their cognitive function, in the way they think, the way they reason and even speak, is, you could, if you look at such people physically, psychologically, cognitively, in terms of their, relationships, occupation, even finances, you could see the impact of drug use all over them. But you find that they'll still be denying that there is a problem. In treating such people, we take them through a level of, what we call the stages of change. Such people are said to be in the pre-contemplating stage, where they still think there is no need for professional help. I am still fine. I am still in charge of this drug use. Anytime I decide to stop, I can stop. Such, we have people like that. But there are professional interventions we provide to carefully help them navigate from that stage to the other stage, where they realize that realization that there is a problem and there is need for help. Once that we can bring them to that stage of realization, they begin to cooperate with whatever strategy, professional strategy, that is being planned to help them. They'll begin to yield to it. They begin to cooperate with the professional, that is available to provide help.
Okay, so professional intervention, you said.
Yes.
So can you walk us through a bit?
Yeah. There are professional interventions available for persons with drug use problem, which is rehabilitation. Okay. The drug demand reduction, which is a broad umbrella for both prevention and treatment. All right. So when an individual has started using, and then also whether he or she has developed drug use problems or addiction or not, and that individual comes in to get professional help, there are a series of interventions that can be provided, okay, ranging from, like for instance, when somebody is addicted already and the individual is screened, okay, there are levels of screening and assessment that is done. One, the purpose of the screening is to establish the possibility of an existing problem. Okay? That's the extent, the outcome of the screening is to establish the extent of the problem. Then we'll do further assessment. Okay? Do further assessment, which is meant to gain insight into the existing drug problem. Once that is done, then treatment, we begin to plan treatment that is geared at what? Achieving the goal of helping that individual to discontinue substance use, which is made up of 3 broad stages. If we're going to take the patient in to rehabilitation, like as in a resident treatment, or we're going to admit the individual into the ward, we begin with detoxification, which is the first stage.
We'll actually look at the treatment options much later in the program.
Okay.
All right, listener, it's 10 o'clock, and you can now join the conversation. Remember, it's Perspectives on our Gate Radio 95.5 Star FM Makurdi, and this edition is focusing on curbing the menace of drug abuse. With me in the studio is Mr. Aboje Ojebe, a clinical psychologist and a drug abuse prevention and treatment practitioner, and an author and a staff of the Department of Psychiatry at Benue State University Teaching Hospital Makurdi. So the number for you to call to be a part of the program is 0814-335-9292. 0814-335-9292. If you have any question, you have someone around you feel is into drugs and you need help, there's anything at all you want to raise about drug abuse, Mr. Ojebe is a professional and he is here to help provide answers to most of our unanswered questions. Alternatively, you can also send us a text to 0912-699-9404 to be a part of the program. Some texts are already coming in due course. I'm going to take them. All right, we have the first caller here. Let's Hello?
Hello.
Hello?
Good morning. Yeah.
Hello, can you hear me? Hello?
Yeah, I'm hearing you.
Okay. I seem not to be responding. Hello? Okay, call us back if you can. 0814 335 9292. Call us back. That's the number. Call us back and let's get talking on perspectives. The menace of curbing the menace of drug abuse. All right, okay. Hello? Okay. You may need to change your position and call us back. 0814 335 9292. Okay, while we wait on the calls, Mr. Ojebe, we will be pushing on the conversation. And right now, okay. Hello?
Hello, good morning, sir.
Yes, good morning.
Greetings to the guests in the studio.
Thank you very much. Good morning.
Yeah, this is the voice of Ado Batlomi Tefa from Bachohan in West Local Government.
All right, Tefa, thank you for joining us.
Honestly, I must thank the guests in the studio for the topic you people brought on board, and he has done justice to that. However, I may like to also advise we parents. It's high time we also monitor the movement our children are what with their peer groups, as they call the guest rightly said. Most of these parents, they don't care to know who my child is moving with. And if you don't care to know about that, it will be very difficult for you to monitor the activities being carried out by your children. As well, I want to also advise the younger ones, that the abuse of these drugs they are talking about, these things are not causing us any good than harm. Because one, the decadence and being provided on these issues we are talking about, it brings a lot of setback in the economy, in your family, in the society. So if we should desist from this, it will help us. The production of these drugs are not meant to be abused. They've done that for a specific purpose. Therefore, if we should adhere to that, it will help us. Lastly, I may like to appeal, is there any number one can call so that you can call to for a help? Maybe one who is who has undergone a lot of these challenges for counseling, and the security agents too should help us. Honestly, they are not helping matters regarding these drugs abuse we're talking about. They are not helping matters, so they should mop up their ways
Okay, Bartholomew,
regarding the
begin to round off
control.
your
Thank
thoughts.
you.
You have made your point already. Where did you say you are calling from?
I'm calling from Bachohon in West Local Government.
All right, thank you very much, Bartholomew. Your question is also
you.
taken, and thank you for your contribution. All right, Mr. Ojebe, is there a number that he can call to seek help? It's just well, I must say that it's not as if we have organized. It's just a sensitization program,
Yes.
courtesy of our Gate Radio. It's not as if any group is sponsoring this.
Yeah.
So there may be, or you want to talk to him about that?
Yeah. If you're talking about there are a number of our organizations around, you know, government-owned organizations, of course, hospitals, private organizations, and civil society organizations, what we call non-governmental organizations that provide care and information, you know, as it relates to drug abuse matters. They are available. Okay, they are available. The Department of Psychiatry, Benue State University Teaching Hospital, Makurdi, it's one point of call.
Hello.
Yeah, a very wonderful good morning to you, Mr. Fanen Kuanum.
Yes, good morning.
Yeah, comrade Michael Teyima Nyekura, also local government area of Benue State.
Okay, Michael Nyekura, where did you say you're calling from?
Material, both local government.
Okay, Michael Nyekura from Material, go ahead.
Yeah. You see, I am 100% agree with the doctor in the house that many people abuse drugs as a result of ignorance and illiteracy in related matters. Imagine someone is complaining of headache, and that person went to the pharmacy and buy paracetamol. So the pharmacy prescribed to be taking 2 tablets 3 times per day, and that person come back and be taking 3 tablets, 3 times to 4 times per day, attributing that my headache is above taking 2 tablets. And I classify that as ignorance and illiteracy on health-related matters.
You're right.
So I want to use this opportunity to advise the society in public that drug is being prescribed according to its generic factors, and we have people that are studying this drug. So anytime you fall sick, you have to seek for medical advice and the prescription to be taken accordingly. Thank you for the opportunity.
Thank you very much. You are right. Thank you so much for that input.
Okay. All right, the number to call and be a part of the program is 0814-335-9292. Call us and let's get talking. Hello? Okay. If you're finding it difficult to reach us via the telephone line, you can send a text message 0912-699-9404. Hello? Hello? Okay. Hello? I mean, there's something wrong with the service provider, but let's look at the prevention and treatment. Let's be talking about that as we take more calls. Hello? Okay, so what strategies can be employed to prevent drug abuse, particularly among young people? You did say, and then thereby affecting, their contribution to the growth and the development of the nation. So, what are the strategies available? But just before then, let's try this call again. Hello?
Yes, good morning.
Yes, good morning.
Yeah, good morning.
This is Magdalene from Yeke.
Okay, Magdalene.
Yes,
Yeah, go ahead.
I have a problem concerning this drug abuse of a thing.
Okay.
Because most times people complain that it is children who are from poor backgrounds who are being influenced by these strong guys to go into this bad habit. But you will also agree with me that the rich man's children are also involved in this act. So what is really, really making the young guys, even ladies, little girls, they go into it. It's not all about the guys. So I wonder, but my major concern here is what can be done to make these people pull out of this act, because it leaves them into so many. Some are thieves. They have become so hardened that they even steal. They are violent and all that. So what can be done what can be done to pull them out of this act and also prevent them from spreading this to the other ones? Because the other ones, the younger ones, may want to also get involved in this act, knowing fully well that it is the wrong thing to do. So what can be done? Most parents are so uneasy, but they don't know what to do. They don't know how to go about it.
Okay, thank you very much. Your question is noted and would be attended to. 0814-335-9292. Call us and be a part of a conversation. Alternatively, send us a WhatsApp or text message 0912-699-9404. Hello?
Good morning.
Yes, good morning.
My name is Godwin Okachi.
Godwin?
Okachi.
Okay, Okachi.
Yeah, good morning, Godwin.
Where are you calling us from?
From Iniki Street.
Okay.
I want to ask the doctor a question. Good morning, doctor.
Good morning, sir. Go ahead.
How can someone stop taking drugs?
Godwin, could you please step away from your radio? It's giving us a hallback effect.
All right. Hello?
Yes, it's better now.
How can someone stop taking drugs?
Okay.
Because in society today, you can see a lot of youth, even adults, they're into drugs. If there is any way that the doctor will tell us so that we'll know how to do it. Thank you.
All right. Thank you very much, Godwin Okachi, for your question is noted. We'll look for an answer to it. So just stay tuned to your radio set, and justice will be done to it. For the records, Mr. Aboje Ojebe is a clinical psychologist, Department of Psychiatry, Benue State University Teaching Hospital, Makurdi, an author and a drug abuse prevention and treatment practitioner. All right. Hello.
Hello. Good morning.
Yes, good morning.
This is Nathaniel Ndongo from Wurukum.
Okay, Nathaniel Ndongo from Wurukum. All right, go ahead.
Yes. I want to ask this question to the guest in the house. When somebody is a smoker, you are smoking this thing, this cannabis and whatever they call SK and whatever they call loud. I don't know. Somebody say a friend of mine was smoking this, and I told him that this is what you're doing is not good. He said he smokes it when he comes back from work, when he wants to relax. He smokes this thing, and he feel relaxed. I don't know. Is it proper for somebody to? He said he doesn't smoke it that much. He smokes it when he wants to relax. So I'm asking this question to the guests in the house: is it proper for you to smoke it when you want to relax, or I don't know.
All right, thank you very much, Nathaniel Ndongo, for your question. Your question is noted and will be attended to. Just stay tuned.
Thank you.
All right, I think it's occasional users you did talk about, but we'll come to that. All right, call us on 0814-335-9292, and then to be a part of the conversation. Alternatively, you can send a text or WhatsApp message 091-2699-9404 to be a part of the discussion. Hello? Hello? Okay, so let's look at some of the issues raised.
Okay.
Okay, Magdalene Ohemba of Yaiko Makurdi said, wanted to find out what could be done to pull young people out of drug abuse.
All right. Magdalene from Yaiko, she made it back as one of the factors contributing to the prevalence of drug use among, the young people. But I did establish when we began that the reason why people, initiate and continue the use of drug is multifactorial. It's not one factor that is responsible. That is what it means, and it's not only an issue for the poor. Both the rich and the poor has this problem. All right, the drug use problem is not a problem for the poor, irrespective of the socioeconomic background. It's a problem of both the rich and the poor. And looking at how we can prevent. If you look at prevention, I've been on both sides of drug demand reduction. I started my professional journey, of course, in DDR as a treatment practitioner. Then at one point I went into treatment, I went into prevention, and then I'm doing both side by side because
Hello?
Yeah, hello.
Yeah, good morning.
Yes, good morning.
This is Annual Chairman from High Level.
Okay.
Emmanuel.
Emmanuel.
Yes, Emmanuel Chair Anne.
Okay.
Good morning.
Yes, this issue of drug abuse is actually a concern now because first, the number of young people that have gone into drug abuse in the last 10 years is very high. And then you see the rate is being commonized now. If measures are not taken, I think it will be worse. So, but let me not elaborate. I think let me just talk on the measures I think this can be curtailed. One, I think they should start introducing this drug test in universities because most of these people that abuse drugs are actually not illiterate. Then I think secondly,
Emmanuel, you
years,
hello.
yes, in the last 3 years, situations stores shut down for
Emmanuel,
some of these
you would
places.
wish to change your position so we can get you clearer. Hello.
Yeah, I can hear you.
Okay, go ahead.
Yes, so I think for the past 10 years, we hardly could see drug agencies close down stores or burn stores because of toxic substance found there. Because there are some of those places, that's just what they sell. So they don't even sell other medical things, like they don't put in energy to sell other medical things. So I think it's more call for those agencies to actually reinforce. And then I think, lastly, I think it would be nice also to look into our social centers, like some of these hotels and restaurants and the rest of them that young people go. Those are easy places they can actually get those things from because it is easier to prevent than trying to control somebody that is already into drugs because they would not even accept it. I have people around me that are already into it, and then when you want to talk about it, it's looking like you're actually going out of point. So I think the more regulations to the incoming of the drugs will really curtail the damage. Thank you.
Thank you very
All
much,
right,
Mr.
thank you,
Emmanuel.
Mr. Manuel
Your
Ocheme.
suggestions and
You're
your
welcome.
points are very valid. Thank you so much.
You can be a part of the program if you dial 0814-335-9292 or send us a text or WhatsApp message 0912-6999-4004. Hello.
Hello, good morning.
Yes, good morning.
Yeah, my name is Justin Umile. I'm calling from behind Augustinian Community Institute.
Justin.
Umile.
Okay.
My regards to my friend there and a great BSU alumni, Aboje.
Good morning, sir. Justin.
Yes. Yeah, I'm very, very happy and I feel proud that one of our own has created a very, very useful insight into the subject matter that is being discussed.
Thank you very much, Justin.
However, I want to say that the issue of drug abuse is also prevalent in not only in younger people but also in adults.
You are right.
That is a fact. But permit me to say that,
Oh, Justin Umile, you can call us back. We really wanted to listen to you. So call us back 0814-335-9292 so that you'll be a part of the program. I think we have some text messages here. Okay.
Yeah.
Hello.
Good morning, the presenter.
Yes, good morning.
This is Ofega Benjamin calling.
Okay, Ofega Benjamin, where are you calling from?
I'm calling from the Air Force Base.
All right. So go ahead and make your submission.
So when we are talking about drug abuse can be seen another way than misusing drugs. People may misuse drugs not because they want to, but sometimes when they have illness, terminal illness that they have been suffering from. looking for solution from one way and another, and they couldn't even find a solution. So now it becomes problem to them. So coping with this illness become a difficult issue that they will go extra mile looking to a solution to their health. So when we are looking at about drug abuse, it's not just because individual want to use drug, but it's because of the condition that they have been managed for so long and they cannot even cope with it. So they are looking for how they will be well. So people may be intent to use different ailments, traditional medicine and even orthodox medicine, so that they will be able to kill their own illness. So other people indulge in it because they have been suffering from a condition that they cannot help themselves. So when we are looking at reducing drug abuse, we can also look in another way that people will be educated and even find solution of how disease can be managed. Maybe reducing the spread of disease or other disease that come into in contact that people can be avoided. Poor water, malaria, and all of those. There are other measures that government can look into that they can help people that go into drugs just because they want to be well. They can also it can be reduced.
All right, Benjamin, thank you very much. You've made your point. People should be educated on drug use. Thank you very much for being part of the program. All right, the calls are still on 0814-335-9292. So, hello.
Hello, good morning, sir.
Yes, good morning.
Yes, sir. This Friday Wilfred Ehibo calling from Pepper Village, Makurdi.
Okay, Friday Ehibo.
Yes, sir.
Calling from where?
Airport Village, Makurdi.
Okay. Go ahead and make your submission.
I want to thank the presenter and those of you there for this topic has been raised.
Thank you very much.
First of all, this issue of drug abuse. Let me start from the family. Some parents, sometimes they won't send their children, go and buy me book or go and buy me cigarette. So they keep sending all these children. Sometimes they want to experiment with it. What is it here that daddy or mommy really sees in this time? He or she always takes this thing. Let me see also. So parents are also to be blamed. And then this morning, before this program came on, just as if maybe this program coming up, I was talking to a boy. I said, you don't want to go to school. You involve me. Your parents want to train you. You involve me in smoking, drinking, taking all this alcohol, and what have you. You will cry tomorrow. So substance abuse. Just for you to ask yourself, what am I going to be tomorrow? If I should indulge in such a thing, we should evaluate ourselves. We should talk to ourselves. You know, the president talk about the man they talk about peer pressure and societal pressure. Sometimes this thing also leads to drug abuse. Even common this thing is motivate. You can go abuse it. Please, I want to really appreciate the presenter, and the government should also do something great to even come down to the level of the local the traditional heads and the elders in the society to even let them educate them how to pass this thing to the people. They are looking for their head, so they can in turn pass it to their children and the community at large. It will really help us. Thank you.
Oh, thank you very much, Friday Hibo. You know, they talked about, he blamed it on parents. Parents are not doing, more. The parents should actually do more. And he said that drug abuse destroys future and called on government, opinion leaders to be involved in tackling the menace. Thank you very much, Friday. That's so valid. All right, you two can join us. Hello,
good morning.
Yes, good morning.
Yeah, I am Engineer Sunday Akpa. I'm calling from North Bank, Makurdi.
Okay, Engineer Sunday
Akpa.
Okay.
Yeah, I appreciate your guest there. He has spoken very, very well, actually. And he has analyzed the issue very well. And I want to agree with you that most of the problems in the society today are caused because of the use of substance, Even yesterday they talked about gender-based violence. And if you see the privilege in the society that is so alarming, and we have to take drastic action to curb it. So I want to agree with one of the earlier callers that even those who are to be admitted into the university or high institution, or even secondary school, they should be subjected to drug tests to make sure that they are free. And even in the churches, couples will be couples that want to marry. They will subject them to drug tests.
Okay.
And even even to be employed, they should subject people, applicants to drug tests before they're employed. Even political appointees, they should subject them. And even those trying to contest for political offices. Seriously, because it's alarming. It cuts across all phases of the society, both the young and the old. And the society is being killed. See people, a privilege of it, you are not free again, moving about. People will just beat you in broad daylight, point gun at you, collect your food, collect your money. They are actually under the influence of drugs. There are some rules that we cannot pass in this state, like this Dakar road. You go there, in broad daylight, they will stop you. People don't act ordinarily. So the influence of drugs is so much. The government need to take drastic action about it. That is my submission, please.
Wow.
All right. Thank you very much, Engineer.
Thank you very much, Engineer Sunday. Beautiful submission.
All right. Oh, more calls are coming in. Hello. Hello. Okay, in our text messages, we have some here. This one is Ilza Mebel from Achusa. Good morning. Curbing the menace of drug abuse has been a topic over the years without the proper means of control. I feel NAFDAC should place a ban on some of these substances people take. NAFDAC should also checkmate the restaurants, clubhouses, and the bars. And for the peers, I feel if social clubs regarding to this topic are created in schools, it will enlighten them better. Thank you very much, Uzar Mebe from Achusa. Okay, we also have this one. It says, drug abuse is an illegal use of substances into the body that change the behavioral pattern of an individual, thereby forcing them to become public nuisance. May we have the institution of new safety procedures to bounce back. Good morning, panelists, and thanks to Kuanum Fanen. I am Otsua Isaac from Guma. Anchiha. Say Jime. Thank you very much, Otsua. And also, this one says, good morning, presenter and your guest, Mr. Aboje Ojebe. Drug abuse is the highest cause of insecurity and crimes we are having in Nigeria and Benue in particular, because illicit drugs are available all over Makurdi town and the law enforcement agents are not doing enough to stop them. Parents should watch out for the kind of friends their children keep so as to prevent. Okay, parents should watch out for the kind of friends their children keep so as prevention is better than cure. And this is coming from Vincent Ako from Wadata. Thank you very much, Vincent, for your submission. Hello.
Hello. Good morning.
Yes, good morning. What's your name and location?
My name is Ahembi. I'm calling from Bayong, Manikaro Kagwam.
Okay. Eungwa Ahembi, go ahead. Hello. 0814-335-9292. The time for calls is still there. All right. So, join the conversation. Hello.
Hello. Yes, Justin, I'm back.
Oh, it's so good to have you back.
Yes, from behind Augustinian community.
Okay. Go ahead.
Yes. As I was saying, I said the issue of drug abuse is prevalent both in the young and the old. But you will agree with me that this just don't start at the top. It starts from somewhere. And I want to look at the family. The family as an agent of socialization. To me, is very, very guilty because most parents now do not really care about where their children goes. They do not care about the kind of company their children goes. So the education at this level, parents are not educating their children enough. Imagine if at the level of kindergarten, if parents are educating their children on the dangers of drug abuse, they will get to understand that it's really dangerous for their health and for their social well-being. And they will try, they will, as much as possible, try to be able to even withstand peer pressure. So I am saying that parents should give their children the right orientation. The schools should also give their children the right orientation about drugs. It will interest you that even women, mothers are abusing drugs. So what do you expect of a child that is being tutored or is being brought up under such environment? Definitely they will take to abusing drugs. So I am appealing to parents that they should warn their children. The kind of company they keep, the kind of things they bring home. As a child, while I was growing up, my father do question me. If he sees me with anything that I acquire or any property, and he knows that he is not the one that bought such a thing with me, he will begin to, where did you get this from? So if we begin to ask our children, when they come home looking very, very helplessly, looking very unusual, we should ask them, we should try to trace what is happening to them so that we will stop, we will nip the issue in the bud. Because as they say it's sick in time, saves nine. Thank you so much.
All right, thank you very much, Justin Umile, for your submission. All right, we'll take a few more calls and then we'll retire back to responding to the issues raised. And then, of course, some of the packages we still have for you that are yet to be unveiled. So 0814-335-9292. Call us and let's get talking on the menace, how to curb the menace of drug abuse. Hello? All right, back to you, Mr. Ojebe. You were talking about drug abuse as raised by Magdalene Yohamba before the court came in as much as they could.
I was trying to talk about prevention. Prevention is always better than cure. And in drug abuse, I always say prevention is better than treatment. Prevention is easier than treatment. Prevention is cheaper than treatment. Okay, treatment here, we're talking about rehabilitation. Okay, and when does the need to rehabilitate an individual comes in when it comes to substance use? Is when this individual has developed problems associated with drug use, and that person can no longer stop on his or her own. All right, but when an individual has not gotten to that level, a few interventions here and there professionally can help that individual. Of course, he or she has a part to play. But when it has progressed to what we call addiction, I would like to define addiction here as addiction is defined as a chronic relapsing brain disease, which is characterized by compulsive seeking and using of drugs. It's no longer about it's a brain looking for consequences on family, despite health consequences, despite financial consequences. All the person lives for is seeking and using his or her drug of choice. So when it gets to that level, it's not about, it's not about the willpower anymore. It is no longer about character to healthcare delivery centers for care. So treatment at that point, that individual is a candidate for a comprehensive drug abuse rehabilitation, or what we call treatment. And it is not always as easy. It's time intensive, it is capital intensive. Are you with me?
Yes.
So the minimum time it will take to rehabilitate an individual, the minimum is 90 days. Minimum. And when addiction sets in, 3 months. We have people that have stayed 6 months, 1 year, 2 years in rehabilitation centers, depending on the severity of the case and the drug of choice involved. And you see, when addiction sets in, addiction cannot be cured. You only recover from addiction. You only manage addiction. There is no surgical procedure that will be carried out on the brain or any part of the body to remove addiction or to remove. That drug has interacted with the brain of that individual to a point that the brain can no longer do without the presence of that substance. Or more that also that the drug must have to heal. That's, the consequences. How how severe, how dangerous addiction is, and how difficult it is to manage addiction or to stay in recovery, we began to emphasize prevention. We began to churn out messages like one of my to stay off. We're talking about prevention. Don't start, don't initiate. And to get off simply means you have started using at any point you are now trying to leave. It is usually very, very difficult. And the goal of prevention, the United Nations Office on Drugs and Crime, spells out the objective of prevention, which is to help young people avoid or delay the initiation of drug use. And for those that have also started using, to help them stop so that they don't develop substance use disorders, or what we call addiction. All right? So in prevention, all right, like the International Day Against Drug Abuse and Illicit Trafficking 2024, the theme is evidence is clear. Invest in prevention. All right? And prevention and treatment, their strategies are evidence-based. It simply means that whatever strategy is brought on the table to achieve prevention has been tested and researched upon and is established that it will produce results. Like in prevention, for instance, prevention is carried out on 4 basic platforms.
Okay.
Number 1, we have the family. Evidence-based prevention can be carried out in the family, can be carried out in schools, through the school, through the workplace, through the community. All right? So these are already existing agents of socialization that has direct impact on people. So this evidence-based strategy is now get the right information and skills to the drivers of these agents of socialization, and they will in turn implement prevention for you. For example, when I do prevention in families, my business is basically with the parents. There are certain things to managers. When I do managers, they are the target for workplace prevention. Then community-based prevention, you look at community leaders and opinion leaders in the community. They are the ones you take your information, and then of course there are other strategies that you implement for young people. Parents and teachers don't know enough to implement drug abuse at home and in school. That gap has been existing for a long time.
Okay, you mean drug abuse prevention or?
Yes, in drug abuse prevention.
Okay.
Generally, parents and teachers, they don't have the basic, what I call drug abuse education. Types of drugs that are abused, that are available in the society today, that our young people abuse, how to know a child that is abusing drug, the causes and consequences of drug abuse, basic information about drug, a lot of parents and teachers do not know. And without adequate knowledge, it will be very, very difficult to parent and guide this generation, the young people in this generation, for you to be able to guide them adequately and effectively parent them and teach them. You need to know what they know and even know beyond what they know. So when this knowledge gap exists, you are only trying to catch up with your young people. You are only trying to catch up. You shouldn't be the one trying to catch up. You should be ahead of them as a parent. There are certain things you should know. When a child tells you, when young people are speaking their coded language and slangs and balances, you should be able to know. You as a parent, you as a teacher, you as an employer, you as a community leader, you shouldn't be in the dark. When you hear things like SK, you hear things like loud. You hear things like high, you should know. Things like meth, crack. You hear things, these are street names for drugs. You as a parent should know. You should have these things at your fingertips. How to know the different reasons why people abuse. A parent and a teacher should have this information. All right? And I will also have other strategies. What we do basically in home-based, in family-based prevention is parenting. The way a lot of parents are parenting their children, it's disheartening. You see, like somebody mentioned, you don't know you don't know who are the friends of your children. You don't know where your children go to. All right? You don't know what they do behind closed doors, under your roof. is a parenting gap. So if parents will adequately adjust their parenting practices, become more, authoritative, insist on the right kind of behavior, and adjust their parenting practices in such a way that they'll be involved in the lives of their children. How many parents now, of course it happens, there are parents that have taken time to build this kind of relationship with their children to a point where a child can walk up to his or her father or his or her mother to say, "Mommy, while in school today, my group, there's this friend I have that have started talking to me about drugs." Of course, some children are that open to their parents, while others, they're not.
And then you did emphasize that it comes like that with authoritative parents, those who, merge discipline with care and love.
Care and love. They are firm, but they are also loving. They are firm. Unlike the authoritarian, where your children are coming, instead of you are coming home, instead of your children to run towards you, they are running away.
Okay.
So in that case, you don't know them. You don't know their challenges. They cannot come to you and express how they feel. So a lot of children can bottle up things, emotional issues, especially teenagers. When they cannot express things, when they cannot approach their parents and unwound before them, they take to their peers, and only God knows what they learn from these peers. So looking at preventing substance abuse from the home front, there are theories behind family-based prevention, which is based on influencing family processes like parenting. It will promote healthy youth behavior and prevent problem behaviors. We look at practices like good parent-child relationship. When that is emphasized upon, it will have preventive, research has it that it will have preventive, value. Effective behavior management strategies. We have staying involved in a child's life. A lot of parents are not involved in their children's life. All right? We have issues like parents who are emotionally, cognitively, and financially supportive provide a multitude of resources for healthy child development. A lot of gap exists in the home front.
All right, so let's move away from that now. We've dwelt on prevention, and I like to state at this movement that prevention cannot be overemphasized. Will I be right to say that anyway?
Yeah.
That prevention cannot be overemphasized when it comes to drug abuse, the issue of drug abuse. Okay, so now we want to go to laws and policies that could address drug abuse. Recently, the National Assembly had come up with the legislation, pronouncing capital punishment on those storing illegally or transporting or concealing drugs, of any kind within them, drugs, illicit drugs with them. They say capital punishment. When you are caught, you are killed. So, how do you think this will help in curbing the menace of drug abuse?
All right. Like I said earlier, before I go into that, in terms of policies, in school-based prevention, all right, the school is also another agent of socialization where prevention can be implemented. I've been involved in that, I think, the last 8 years, going from schools to schools. I've lost count of the number of schools I've been to in Makurdi to train, provide knowledge and skills to teachers and school managers, which involve, how to interact with learners, how to interact with learners, how to manage the classroom, how to help students have this level, how to help students build this, strong connectedness with the school and the learning process. That also has been proven by research to increase the, to reduce the risk factor to problem behaviors like drug abuse. And are also involved in helping school authorities to, formulate school-based prevention policies against drug abuse. It falls within the umbrella of substance abuse prevention, especially school-based prevention. Then looking at government agencies and public policies that has to do with drug abuse prevention, especially like we have the National Assembly in Nigeria, coming up with legislations, and all of that. We have government agencies like the NDLEA who have who are saddled with enforcing these legislations about drug abuse and illicit trafficking. Basically, like I earlier said, the primary or the basic responsibility of government agencies like the NDLEA is to track, traffickers in order to reduce to the barest minimum the availability of substance. Of course, like I said, availability influences demand. So if there is no availability, of course, there won't be demand. Demand will rise, but if there is no availability to suit it, the demand will fizzle out. So now, it's a welcome development. I don't think the essence of that is to kill anybody, all right, but to serve as a deterrent. Of course, there are countries. This is not Nigeria is not the only country that is looking at that, coming up with such legislation. There are countries like Singapore, countries like Malaysia, and Asian countries majorly that have these strict laws about drug abuse, considering the negative consequences of drug abuse on the citizens, on the workforce. If you look at the age of prevalence of drug abuse, for example, between the age of 13 and 30, that is where you have the energetic workforce of any nation, and that is the age that has been ravaged by the menace of drug abuse. All right, so consider also looking at the health consequences, the social consequences, insecurity, being at the receiving end or as a result of drug abuse. Basically, it is a welcome development that traffics drugs by mistake. People see it as a lucrative business. People go into it. People set up labs. People set up, illegal labs where they mix chemicals and come up with all manner of substances that can be smoked for individuals to achieve high. Like crystal meth, for example, is a derivative of a drug called amphetamine. And then we have this derivative of amphetamine called methamphetamine. I don't know if you heard about ice. The Igbos call it umpurumiri. It's one of the most potent stimulants that leaves destructive consequences on the users. There are people in Makurdi, young people that abuse, that smoke meth today. Crystal meth is not a prescription medication. It's a mixture of so many things, so many deadly chemicals, including the acid in car batteries, refrigerants, different chemicals, rat poisons put together and cooked. And people are operating illegal labs that cook these dangerous substances and then ship them because it has become a cash cow, making money at the expense of the society, making money at the expense of the lives of people. A lot of young people that have told the path of drug can no longer realize their potential and become contributing members to their family and the society because of the initiation of these substances. There are people that have taken that up as a source of income, and those are the people that this legislation is out to either deter them from continuing in this trade or arrest them and confiscate their supplies and bring them to justice. It has gotten to a point that the nation, through its legislative arm, has to rise up to the occasion and bring solution to this problem.
Okay, so at this point, what message would you like to convey to those struggling with drug addiction, and how can they access help and support? And that would be your final note, if you wish.
Yeah. I would like to state that anyone that is using substance, you may not have developed addiction yet. You still think you can stop whenever you want to stop. It is better to stop when you can stop. All right? It's just like any other health condition. Someone says, take yourself to the hospital. Get to the hospital when you can take yourself to the hospital. Do not wait until your health has deteriorated to the point that you need somebody to now bundle you to the hospital. All right? It all requires professional help. You are a drug user. You have started using drug. Maybe you're still experimenting, and then from what you are getting, you like the feeling. I want to strongly discourage you Drug may look like an escape route from your problem, from the employment, from the unemployment, from the frustration. You may be using drug to unwind after a busy day and to relax. That you relax from smoking marijuana after work does not make it proper. Somebody asks, it is not proper. That it is giving you a relaxation, a feeling of relaxation after a hectic day does not make it a healthy option. It is not a healthy option. What you are sending into your brain is a chemical that alters your brain. All right, it alters your brain chemistry. What anybody may call high. You take a psychoactive substance, you feel high. That high simply means something wrong is happening in your brain, and when that happens over a period of time, your brain will be permanently damaged. All right, so it is not proper to relax with psychoactive substance. There are other ways, healthy options to relaxation. And for those that are using, please seek professional help. All right, you have started using psychoactive substance you've used for a very long time. You feel you cannot do without it. You wake up in the morning, the first place you go is an ogogoro joint to go and drink and smoke, and you are there all day till evening. It's possible you have developed dependence, and there is help. There is help. Walk into Benue State University Teaching Hospital, Department of Psychiatry, and ask for help. There is Department of Psychiatry in Federal Medical Center. Go and seek for help. There are professionals, trained, psychiatric doctors, psychiatric nurses, clinical psychologists, social workers. They are there to help you. Okay? The government of our amiable governor, Governor Alia, has also through the leadership of the Benue State University Teaching Hospital, has employed a good number of clinical psychologists. The Department of Psychiatry and Psychosocial Center is functional to provide help for persons with drug use problem. You need professional help, and you will get professional help when you go ask for them. And also,
okay,
you are out there, you are thinking of initiating substance use. You are being pressured by your peers to initiate substance use. Learn to say no to substance use, because I have a couple of messages here to leave with you shortly before I leave. One of it says,
we're totally out of time, so try to do that. So
getting high will only drag you down. This is a message for somebody. I also like to say, turn your back on drugs and face your future. And finally, I will say, look for opportunities and not drugs. And it is easier to stay off drugs than to get off drugs. That's my final message for you. Thank you very much.
All right, thank you very much, Mr. Aboje Ojebe, a clinical psychologist, drug abuse prevention and treatment practitioner with the Benue State University Teaching Hospital, Makurdi. Thank you very much for your thoughts on the program. And listener, that's our program for today. Join us again this Friday for another edition of Perspectives. I'm Fanen Kuanum. Good morning and many thanks for listening.
Thank you very much.